Behind every statistic is a story that changes everything. Tonight, we share the deeply personal journey of a Kenyan woman who faced an unplanned pregnancy, chose abortion, and has carried that experience ever since. But instead of silence, she found her voice. Now a pro-life activist, she's speaking out and asking, what does it truly mean to protect life? And how can we, as a society, do better in supporting women before they feel alone in that choice?
In a country where abortion is largely restricted, Akech Ayimba turned her personal pain into purpose, using her own experiences to champion life, offering support to women.
I am twice post-abortive. That means I have had 2 abortions. And during that time, I did not know a way out, and I got into a crisis pregnancy. And so my first abortion was introduced by an authority figure in my life. I had been accepted in the college of my dreams. I actually wanted to study media, and I was scared that I was going to lose that opportunity. And I went and had an abortion, but I remember the first feeling that came after that was just low self-worth, and like my confidence went out of the window when I walked out of that abortion clinic. I was going through what we call post-abortion syndrome. And when a woman is going through that, it's easy for them to, get sexually active because they're trying to cure worthlessness and avoid in their hearts and pain. And so I got sexually active with someone and got into my second abortion. And let's just say the post-abortion syndrome just went from one level to another. And so when I got to terms with what I had done, reconciled with the fact that I had done wrong, I actually found a place called Crisis Pregnancy Ministries, which is under the Kenya Youth for Christ. So when I found my healing, I felt many women are out there and they are dying with the pain and the shame of abortion. And I felt a call in my heart to be able to reach out to them.
Akech says women seek abortions for a range of complex reasons.
I have seen women from teen years all the way to, I think, 52-year-old. And these women are from different socioeconomic backgrounds, different religions, and all of them come with the pain of abortion. The most prevalent issue is abandonment, because it takes 2 to tango, And when one person is pregnant, has the reality of carrying the baby, and the man absconds his responsibility by switching off his phone, moving from the place where he used to live so that this woman cannot find them, telling the woman, I don't know who you are, when the woman calls. But even if they desperately want to keep that baby, they're human beings. They're going through anger and frustration.
For many women, the experience of abortion leaves lasting emotional scars.
The first thing they tell us is, I hate that watchman who opened the gate to the clinic for me. I hate that nurse who wrote my name down first. I hate that doctor because he did not tell me what I was going into. So the first thing they actually do is regret the fact that they even thought of having an abortion, And that tells me they wished that somebody would have told them otherwise. And what is this otherwise? That abortion is not the cure, is not the solution, that there is help. When you're in a crisis pregnancy, there are other options, like adoption or parenting the baby.
Shocking findings in research done by the African Population and Health Research Center and Guttmacher Institute in a study done in 2023 in Kenyan public health institutions revealed that in 2023, Kenya reported over 700,000 abortions. 78.6% of the women that had abortion-related complications were married women. I spoke to Charles Kanjama, an advocate of the High Court, on the current law on abortion in the country.
Abortion is prohibited. It is a criminal offense. Both the person who procures the abortion, the medical doctor or healthcare professional who carries out the abortion, and the pharmacist who sells abortifacient drugs. But there is Section 240 of the Penal Code that gives an exception and says if there is a surgical or medical intervention necessary to save the life of the mother, then that will not be treated as abortion. We need to have a multifaceted approach to deal with the pressures that the women face and see how we can, for example, make employers more recognizing of the law that you should not discriminate against a woman on the ground of pregnancy. Then the other factors is a poor regulatory environment. There are many pharmacies, clinics, chemist shops that are dispensing of abortifacient drugs. These are not meant to be over-the-counter drugs.
The National Reproductive Health Policy 2022-2032 promotes pro-life policies.
The support systems are there, so we're talking about crisis management, crisis pregnancy centers, talking about options of adoption rather, and we're talking about also the other aspects of even counseling and working, with these mothers.
There have been concerns over family planning failures where women get pregnant despite being on a contraceptive.
That does happen, and we discuss that. So when we discuss that, it's for them to understand the failure rates. They're actually there, and they're not the same. There are some that have very high failure rates. So we take people through the various methods and their failure rates. So we give them options. We encourage women to come with their partners, come with their husbands. We're able to talk about all that so that then they actually support them.
The current reproductive health policy is one of the best, in fact, if not the only best we have had, because this reproductive health policy actually has the aspect of crisis pregnancy intervention, and we actually fought to put it there because we realized that other policies prescribed abortion, prescribed contraception, and people need behavior change, and that's what we do, You can pump contraception on someone, but it's not always that they will use that contraception. Where is the place of behavior change? Where is the place of intervention?
In the heart of Kenya's heated abortion debate, one truth remains clear. The sanctity of life continues to challenge, convict, and call a nation to reflect on its deepest values. Lillian Muli, Citizen TV.